The topic of this presentation, it's about dental implants components and restorative components of dental implants. So in general, we can talk about dental implants having dual purpose. If we use them for fixed restorations, we can do single tooth restoration, or we can use it for replacing multiple missing teeth uh, by having them as an anchor to a bridge. Um, Also, what type of restoration we can put on top of the implants depending on the doctor prescription. So we can use either porcelain fused to metal or all ceramic restoration. For provisional type of restoration for fixed, we can use um, temporary restoration using acrylics or composite resins or PMMA, which is um, material used in milling for the CAD/CAM. So in general, when we're talking about using a dental implant to restore a natural tooth as a fixed type of prosthesis, we're talking about having two or three elements. Again, also depending on the doctor prescription. So, for instance, if the doctor prescribes to have a screw retain restoration, then we're gonna have an implant, the implant body, which is placed into the bone, and then we're gonna have what's called a titanium base, which is a prefabricated abutment, and the final restoration or the screw retain crown, which is cemented or glue to the titanium base, and everything is screwed into the implant and insertion into the patient's mouth. The second type of restoration could be a cement retain restoration, and again, the doctor selects which type of restoration, screw retain or cement retain. The cement retain restoration pretty much has kind of like the same components. We have the implant body, which is inserted into the bone, and then we have the prefabricated abutment or the custom abutment, and then we have a crown that it's cemented on top of the abutment. So the difference between screw retain and cement retain is that the screw retain it's screwed into the implant. The screw retain crown or restoration is screwed into the implant. The cement retain restoration it's using an abutment, a custom abutment or a prefabricated abutment, and then the crown is cemented on that abutment. Another purpose of dental implants, it can be used for removable restoration as a retentive element. So for patients that they wear dentures and they have dentaless arches, in order to retain the dentures in their mouth, because if the patient wears dentures for a long time, the bone resorpts. So therefore, the dentures or the partial dentures, they losing retention pretty fast. So in those cases, the implants act as a retentive element for either the partial denture or the complete dentures. Again, there are different type of restorations that we can use in restoring the patient oral function and aesthetic using removable restoration, such as removable partial dentures or complete dentures. And they both can be fabricated by either the traditional way or the newest technology using a CAD/CAM system. The restorations for edentulous patients are retained in the patient's mouth using different implant components, either by using a position locator and attachments or a bar substructures. And we're going to learn about this in our future lectures. So what are some of the components of the implants? So according to the Air Force manual, the Air Force manual calls the implant body, the part that goes into the bone, a fixture. So implant fixture or implant body is the part that is screwed into the bone and goes through the osseointegration process. A cover screw, it's a screw that has a bigger head, and the purpose of the cover screw is to keep the area of the implant after the surgery free of growing bacteria or food getting in there, so to maintain hygiene and allow the gum to heal properly. An abutment is an implant component that makes the connection between the implant body, the part that is in the bone, and the restoration. Okay? A healing abutment that looks more like a screw, only that the head of the abutment, it has a different shape, and the purpose again of the healing abutment is to allow the gum to heal and to reshape the gum to have that nice scallop natural look. A specialized abutment, those are different type of abutments that are used depending on the purpose, especially depending on what type of final restoration will be placed on the implants. So a specialized abutment could be a locator if we're using removable type of restoration. Also, we have specialized abutments that are engaging or non-engaging. I'll explain about that later. So those are the abutments that are not standard. Angulated abutments, those are the abutments that they deviate from the straight 90-degree angle up and down shape. So those are the abutments that are used for cases where the implant is not in the is not placed in the ideal position. And to compensate aesthetically for that, we can use a angulated abutment that can aesthetically uh, move, aesthetically not moving, but allowing the final restoration to look as a normal location of the restoration. Healing caps are also kind of like the same, like the healing abutment, in the sense that they are placed on the implant body, and their purpose is to allow the osseointegration process without any food or any bacteria growing around it. Temporary components, so there are a lot of temporary components for the implants, including um, temporary implants, body, and those are used for the period of time where the patient is healing after the surgery and during the osseointegration process. Impression copings or transfer copings, those are very important, especially when the doctor takes a physical impression. So the impression copings are placed into the patient's mouth, inside the um, implant body, and then the dentist takes an impression, and those impression copings, they will stay into the impression, inserted into the impression. And then when the doctor sends the impression to us, we receive it with the transfer coping or impression coping inside, and then we're going to attach the replica, and we're going to fabricate the master cast. Guide pins. Guide pins are kind of like screws, but they're longer screws, and they are used for um, seeing the orientation and the position of the implants in the model. So when we put the guide pin inside our um, model where the implant is in the replica, we can kind of see if the implant is parallel, if it's aligned with the other maybe natural teeth or other implants that are placed in there. And also the guide pins, it's a help for us when we do the wax up, because um, when we set the guide pin and we start doing the wax up, no wax is going to go inside our uh, tie base or replica. Abutment replica are used, so those are only restorative components of dental implants, and they are used to they are placed into the model, and that shows the exact location and position of the implants into the patient's mouth. A gold cylinder are used as a component, more like a base for an abutment. Gold screw. So sometimes many companies, implant companies, they are using different type of screws. There are separate screws for laboratory use and also for clinical use. They have the same profile and design, both of them. The only difference is that the lab screw, first of all, it's not um, disinfected or sanitized, and the lab screw sometimes may be uh, made out of titanium, uh, not made of gold, because we're using the lab screws. We put it in, we tied up the uh, abutment on the implant, we take it out. So many times when we do those procedures, the threads of the screws might be worn out. So that's why the implant companies, they decided to do the same screw but for different purposes, clinical and laboratory. And a protection cap. Protection cap, it's also very similar with the healing cap, in the idea that it protects the implant around the gum to not have food and bacteria get into that area after the surgery. So we can see here different type of implant components and their function. So when we're talking about prosthesis screw, we have, like I said, two types, the clinical and restorative, or the clinical and the lab screw. We have a coping that it's mostly a restorative part, analog that are restorative. And again, we have to be aware, first of all, the implant system that the doctor uses for the patient, so we can order and use the implant components that works with that system. The implant systems, they're not interchangeable. So if I use Nobel Biocare implants, they're not interchangeable from Straumann dental implants. So each company has their own lines of dental implants, including size and different designs, and we always have to match what the patient has in their mouth. The abutment also can be used for both clinical and restorative purposes. The same for the healing cap, and for the clinical, we have the cover screw and the implant body, which is, the implant itself inserted into the bone. So the body of the implant, again, when we look at it, it looks a very simple type of design. But again, there are so many type of designs in terms of the threads, how the threads of the implants are placed, the size of the threads, also how the surface of the implant is, if it's a coated surface, um, also in terms of the size. So it can be a narrow implant, it could be a regular size, or it can be a wide platform, a wide implant. So the size also it's given by the manufacturer. So how the size is selected, it depends on the doctor who placed the implant. Um, and they have to look at different clinical aspects, such as the bone density, the location of the implant, right? So for instance, if a patient needs an implant on the for number 11, a canine that has a long root, right? So probably the surgeon might decide to use a longer, maybe a 10 millimeter implant. If there is another patient that needs an implant on a molar or a premolar on, let's say, um, on the lower jaw, then maybe the implant length should be a little bit shorter, especially on the mandibular where we have the nerve. So placing an implant in the mandibular, it's a little bit complicated because the selection of the implant has to take care of not going too deep or too close to the nerve. So there are also different components of the implant body. So as we can see in this picture, we have the apex or the bottom of the implant, and this has, sometimes its own design. It can be more taper, it can be flat, it can be a different shape. The body of the implant itself, where like we talk about the different type of threads on that body, and then the platform. The crest model and the platform, it's the top part of the implant. It's the part that it's close to the gum, and also is the part that receive the abutment. Um, so how the implants can be placed in the patient's mouth. They can be either screwed, self-tapping screw, um, or a hollow cylinder, hollow screw, or many other designs. The more common material for dental implant body, it's titanium. And that's because it's inert material. It's very biocompatible. It's a light metal, and it's very well received by the body. Another new material that's used for implant body, it's also a zirconia. Um, and zirconia, again, it's an inert material. It's very strong. It's almost the same strength as the titanium. It's more aesthetic because it looks more like the root form of the tooth, the color of the tooth. The only difference and why it's not used widely is that zirconia, it's a brittle material. So if a patient puts too much force on the implant when it bites down, that may break the implant. So we see here different types of implant body shapes and design, and also platforms. So what's important to take from this slide is to keep in mind that there are two major types of implant body, where we have external platform or internal platform. Okay, so what that means, it means that the the design of the implant for the exterior, it's outside the the body, the implant body. And if it's internal, that means it's inside the implant body. Why is that important, and why it's important to have this design? It doesn't matter if it's external or internal, is because uh, having this design inside the implant body allows for the abutment to be locked in, meaning that the abutment will be positioned in the patient's mouth and will not rotate or move. So this is extremely important to have a successful restoration and also a lasting implant. So that design of the uh, dental implant body, like I said, doesn't matter if it's internal or external, it's put there with the purpose to lock in the next component, which is the abutment. Um, so again, we have to be careful and to learn and be familiar with the names of different type of dental components. Many companies, manufacturing companies, they have their own name for the same type of product. So getting accustomed, especially when we start using um, an implant system, get accustomed with what the company's products are and also how they name each product. So, for instance, Nobel Biocare for um, their internal three-lobe um, implant, they call that replace select regular size. Okay, Straumann, on the other hand, they call their implant system, which is internal, right? They call it CrossFit, regular size. So it's the implant has the same kind of design. If we think about it, there are variations from company to company, but they're both implant bodies. They both have an internal design, and they both have um, platform, right? So, and they're both regular size. Each company has their own internal design and also their own design of the implant body. A cover screw is placed or screw into the opening of the implant body at the time of the surgical or the surgery. Cover cover screws allow the fixture to osseointegrate with the bone without the bone or tissue growing into the opening or in the body of the implant and allowing for the healing process. The abutment. Abutments, again, they come in a variety and a multitude of the different shapes and different sizes. And the most important thing to remember when we choose the abutment, again, we have to choose the abutment that goes with the system that the implant placed in the patient's mouth, the size of the implant placed in the patient's mouth, and also depending on what type of restoration we're going to use or we're going to do. What's the type of final restoration? If it's fixed restoration, we have different type of abutment. If it's removable restoration, we have different type of abutments that act more as a retentive element. Okay. Um, when we're talking about abutments, again, we have to be careful also on the type of the abutment and the restoration, especially if we're talking about a long span bridge or if we're doing a partial or a complete denture um, restoration. What type of abutment we're using, right? So we're talking about engaging and non-engaging abutments. And the engaging abutments, those are the abutments that locked in very well with the implant body. So they don't rotate, they don't move, they're very stable in there. And those are used for fixed prosthesis, especially single crown, where we don't want any movement in there. Now, the non-engaging, if we look at the design, we see that the platform of the non-engaging, it's more smoother, it's more rounder. So this design allows for more a little bit of movement or rotation into the implant, and this is very well calculated. It's not, that implant it's going to that abutment it's going to rotate 360 degrees. So it's a very little movement that allows for the insertion, the path of insertion of the long span restoration. The two pictures on the bottom where we see how the abutment it's locked in into the dental implant body. The first one that we see with a little purple screw, that's the engaging type of abutment, and the other one it's a non-engaging. Okay, what are the abutments of components? So now, when we looking at an abutment, right? What we're looking for? We're looking at the shape of the abutment, and the shape also is very important in terms of how the final restoration is designed. Okay, so some of the abutments that we can either do it, we can buy the prefabricated ones, or we can do what's called a custom abutment, where we do it in the lab, either using a CAD/CAM system or do it the traditional way. But some of the components of the abutments are the emergence profile, which is the part of the abutment that comes in direct contact with the soft tissue or the gums. And that part must be smooth and polished to avoid soft tissue damage, and must be concave, not bulky. Also, because if it's bulky, it's going to push the gum away and it's going to create a space between the implant and the gum where the food gets trapped in there. The margin of the abutment represents the finishing line for the dental restoration, or the junction between the abutment and the restoration. And again, we have to be careful how we place or how the margin is placed. If we do the custom abutment, how we place the margin. If not, when we order the stock abutment, we have to be careful how we want that margin to be above the gum line, at the gum line, or under the gum line. Okay. The subgingival aspect, it's the most desired because placing the margin subgingival gives us better aesthetics. And the body of the abutment provides support for the restoration. And this is, again, very important to understand what's the purpose of an abutment. So the abutment, it's the component that makes the connection between the implant that it's placed into the bone to the restoration, right? So it's the part that holds the restoration in place. Now, if we think about how the doctor prepares a natural tooth, right? Usually for anterior abutments, the shape of the abutment should be long and narrow. And especially the margin should be placed subgingival for aesthetic purposes. For posterior, we can have a shorter and a wider design of the abutment because that's the space of a molar, it's much bigger than the space for an anterior tooth. And also the access hole or the screw channel, which provides an access for the insertion of the screw. Again, that screw channel has to be very clean, very smooth, and the screw has to go in very easy. What type of abutments we can use? So we have different type of abutments, such as temporary abutments that are used for provisional restoration, and they are used usually by the doctor at the chair side for relying the provisional restoration that we did in the lab previous to the surgery. The dentist can cut and reshape the temporary abutment as needed, because usually they come in a longer size, and then the dentist can cut it back and fit it over the temporary restoration. They are fabricated using different materials, such as either can be stainless steel or plastic, and they are attached to the dental implant by clinical screws. Healing abutments. Those are used in place of standard abutments following a second stage surgery, and they are desired when specialized abutment is needed for the restoration or when the length of the standard abutment is not known. So for instance, if the dentist doesn't know yet um, how long the abutment should be, right? It should be maybe 3 millimeter or 5 millimeter, then this healing abutment is placed in there just to keep this area clear, and also just to kind of protect the area. These abutments are provided as a one-piece abutment and screw. The abutment allows the tissue to heal and reorganize into a unique perio-implant membrane. The healing abutment is available in multiple heights to accommodate the soft tissue variation. So for people who have deeper or thicker soft tissue, they're longer. For people who has their soft tissue is a little thinner, then they're shorter. Also, they can be straight or flared or anatomical to assist the soft tissue reshaping. Prefabricated or stock abutments, which have different designs and different materials, and again, always correlate the abutments, the prefabricated abutments, even if it's from the same company, with the design of your implant, with the system of the implant, and also the size of the implant. Many of them are color coordinated, so it's easy to match, and that should be also each company has their own color coordinated. So for instance, if let's say Straumann is using a purple color, purple in Straumann sometimes means regular or standard size. For Nobel Biocare, purple means narrow. So always have to make sure you understand the implant system and the components from the manufacturer instructions. Okay, so those abutments, they can be either for fixed prosthesis and also for removable. And again, they have different shape depending on what we use them for. Multi-unit abutments are designed to be used in the areas where the implant is deep into the tissue, the implant parallelism is an issue, and also the bone is strong to support short implants. And they come in different sizes and angulation. So those are mostly used for um, full mouth restoration, full mouth bridges, when we have for one bridge for the upper and another bridge for the lower. And like the picture shows, picture in the bottom, it shows sometimes, depending on the bone quality, the implants may be placed not parallel to each other, but those multi-abutment units, they can help us with the parallelism, okay? So those are very important components. Custom abutments. Those are the abutments that we fabricate in the lab, either for each patient, and like I said, we can do it either by hand, the traditional method, or we can do it using CAD/CAM. When we do custom abutments, we have a variety of material at our disposal to use. So we can do it in metal. We can use semi-precious dental alloy, or we can do it in Emax. This is the traditional way. When we do in CAD/CAM, we can do it in either titanium or zirconia, or Emax for that matter. We can mill Emax. Straight or angulated abutments. Straight abutments are used in most cases. Angulated abutments are used to compensate for the implant position, that it's not in an ideal place, in an ideal location, or maybe it's placed a little more lingual than we want it, okay? Fixtures or the implants need a sufficient amount of bone to be properly implanted. There are cases where the fixtures are angulated to the facial or the lingual to do improper or necessary implant placement. So sometimes it's necessary to place an implant on an angulated, pad, because that's how the bone it's strong. The area where the bone is more dense and stronger. Okay. However, a correction of this magnitude will create a destructive level system on the final restoration. This is most common seen when a severe labial undercut in the anterior alveolar ridge dictate the labial angulation of the fixture. So in general, when we're talking about the anterior placement of the implants, we have to keep in mind from clinical standpoint that the bone of the maxilla is more porous, and when the patient is losing a tooth on the maxilla, the bone shrinks faster. It's not so dense. Okay. Therefore, when the doctor places an implant, they looking for where the bone is more stronger and also more dense. So sometimes they have, like I said, they have to put the implant in a more maybe lingual position or more distal or mesial, and it's not aligned with the natural teeth. So that creates a problem for us in restoring the restoration. But using those angulated abutments gives us the opportunity to fabricate a restoration that's going to look natural. Angulated screw channels, those are another type of very much used abutments, and especially when we're talking about placing an implant on the molar, a second molar area, right? So for the doctor, it's very hard. We have sometimes patients that they can open their mouth very big, so it's very hard to get in there and insert that little screw. So when we have a straight screw channel, it takes a little bit of dexterity from the dentist to find that screw channel and place and tied up the screw. But having this angulated screw channel, especially towards the mesial, allows the dentist to have more easy access to the access hole and to manipulate and tied up the screw much easier. Also, based on the dental material used for fabricating the abutments, they can be cast in gold alloys. We've talked about this. Can be chrome, cobalt, and stainless steel dental alloys, dental ceramics, like we saw. We talked about zirconia, even IMAX, and titanium alloys. The prosthesis or the restoration is the part that it's inserted into the abutment, okay? So that's the last part of the implant restoration. This can be attached to the abutment through the use of screws, cement, precision attachments, magnets, or other designs such as those using removable implant over dentures. Again, there are different implant system for retention of denture and partial dentures, and we're going to talk a little bit about this later on. The design of the restoration must match the patient's natural dentition anatomy and aesthetics. And we have, like we saw, different type of prosthesis, fixed from single crown to bridges to full arch restoration, and removable partial and complete dentures, and different type of materials that we can use for the final restoration. We can use porcelain fused to metal, or we can use ceramics. Another type of dental implant component that we usually use, especially when the dentist take an impression, a physical impression, are the transfer coping or impression coping for fixed prosthesis. Most important manufacturers use the term transfer and coping to describe the component used for the final impression. Okay, so this is not using the preliminary impression, because sometimes we don't know where the placement of the implant will be. So that's before the surgery. The impression coping is placed or screwed on top of the abutment before the final impression is made. The impression coping is then picked up inside the impression material to transfer the exact location or the fixture or abutment into the master cast. Before the impression is poured in dental stone, an abutment replica or analog is attached to the impression coping. Then the cast is poured, resulting in the analog being positioned in the same location on the cast as the fixture or abutment in the patient's mouth. So there are two types of impression or transfer coping. The indirect transfer, where the coping is screwed into the abutment or the implant and remains in place when it's set, the impression, and it's removed from the mouth. The indirect transfer coping is parallel-sided or slightly tapered, so allow the easy removal of the impression, and often has flat sides or smooth undercuts to facilitate the orientation in the impression of the removal. Those are used for closed tray impression. So closed tray impression copings, they have a specific design. They're more rounded. The sides of the copings are aligned to each other, are parallel to each other. And those impression copings are, the doctor takes the impression from the patient's mouth and then it inserts the impression coping into the impression. Now, the direct transfer, and this is the more accurate way to take an impression, it's also called an open tray impression. And the difference between those two is that when the doctor decides to use an open tray impression, he or she has to prep the custom tray or the tray for the impression. So where the implants are located in the patient's arch, the doctor has to make a hole into the tray where the implants are, okay? And then they fill up the tray with the impression material, and they place the impression coping into the patient's mouth, into the patient's implants, and they place it with the screw. So when they take the impression, they have to unscrew the screw, take out the impression, and that's where we're gonna see that the the screw comes out from the tray. So if you remember in your lab, the impression that you put up had the screw that came out from the impression tray, right? So that's an open tray impression, which is more accurate. Transfer coping or impression coping for removable prostheses, also called locator impression copings. For taking the final impression for removable prosthesis, partial or complete denture retained by dental implants, the impression copings have a different design because they are used as a retention mechanism and not so much as a restoring. There are different transfer coping also in terms of the height, the shape, the size. Okay, so those are indirect transfer coping, and they have two pieces. The housing locator is the metal part, and the O ring, which is inserted into the locator. And those O-rings, they have, if we look at the picture in the middle where we see um, the locator with the little black insert, that's the O-ring. And the purpose of the O-ring is to retain the replica into the when we put up the model. Okay. Implant analog replica for fixed prosthesis. An analog it's sometimes, or a replica it's sometimes, that shows it's a piece that shows us exactly the position of the implant and the location of the implant in the patient's mouth. Okay, so if we look at the picture here, we can see that we have the transfer coping or the impression coping that it's embedded into the impression. And if we look very closely, we can see that this is actually an open tray type of impression because the screw is outside the tray. And the part that goes into the top of the transfer impression coping, that's the analog. Okay, so the purpose of the analog is to be transferred into the model that we're working with, and that's gonna act for us as the implant acts for the patient. Okay. Um, Again, for removable type of restoration, we have different type of analog and replicas. Those are not screwed in; those are just placed in. And again, they come in different shape to match the system that we're using, and also the size is different. So we have different sizes. The restorative implant components. So we talk about the titanium bases as implant abutments and UCLA or gold adapted abutments. Okay, so the titanium bases are used in the fabrication of the final restoration. They are prefabricated or stuck abutments and have to match the implant system and size. They can be engaging or non-engaging depending on what type of restoration we do. The UCLA or gold adapted abutments are used mostly for the traditional way of fabricating custom abutments. So if we look at the picture, we see that we have a base, right? It could be a titanium or a gold-plated base and a plastic sleeve. Um, so the plastic sleeve can be cut to the desired length, and then we can do a wax up using, that plastic sleeve, and then we can cast it um, in metal. Okay. And again, the UCLA or the gold adapted abutments can, be engaging or non-engaging. They come in different sizes and design to match the implant system used. Uh, Again, we're talking about screws, and We kind of went over the laboratory screws and the clinical screws, um, and we mentioned that the fact the clinical screws are not used in the laboratory because we don't want to worn out the threads of the screws. So we want to keep that the retention for when the restoration is inserted into the patient's mouth, okay? And also they come sterilized versus the laboratory screws that are not sterilized, okay? Usually they are made of titanium and they must match the implant system and the size. Also, some of them, they are gold-plated screws. Guide pins are similar to the abutment screw, only that they are longer. They are an aid for the dentist to identify the parallelism and the position of the implants in the patient's mouth, and also helps the technician to identify the and helps with the waxing procedure. Everything has to match the implant system and the size of the implants, okay? Screwdrivers. So screwdrivers are used either by the dentist or the technician to tighten up the implant screws. They must match, again, the implant system and the size. They vary in length. They can be short ones that are used for posterior screw insertion in the patient's mouth. Wrenches also are used for in the clinical um, at the insertion, okay? And the wrenches are used to tighten up the um, restoration to a specific um, tightness, so the implant doesn't get too loose. Also, the dentist has to know how much he can tighten the restoration in, because if they tighten it up too much, they might damage either the implant starts to move into the bone or they might damage the abutment. Okay. Um, Scan body or position locator are used for the CAD/CAM method to show the location and the position of the implant for the digital model. Again, they match the implant system and the size, and they can be clinical and laboratory. Why they're different? Because if the dentist uses an intraoral scanner, it's not going to take a physical impression. So it's using an intraoral scanner to take a scan of the patient's mouth. That's our impression. They can use what's called a clinical scan body to insert in the patient's mouth, and when he takes the scan of the patient, that scan body is going to match with the scan body that we use for the design of the restoration. For the laboratory scan bodies, those are used by us, the technicians in the laboratory, when we, let's say, receive an impression from the doctor, or we fabricate the model and then we have to scan it and fabricate the restoration using a CAD/CAM. So they're the same size, they're the same design, they're only they're for different purposes in the patient's mouth, and they are sterilized and also for the lab purposes. Um, there are other restorative implant components that are used either for CAD/CAM system or analog methods, such as locator castable threads, inserts for removable prostheses, and these are used for analog methods and come in different sizes and design, and they are made of castable plastic. Sleeves for surgical guide that used to be inserted into the surgical guide to protect uh, the surgical site when the doctor places drills into the bone. So the drill doesn't, shave some of the acrylic from the surgical guide and gets into uh, the surgical site. It's the dental technician's responsibility to be familiar with all the implant components and to use them following the manufacturer instructions. Because of the dental implantology field, it's evolving. Dental technicians must participate in educational and training courses, seminars, and workshops to learn the latest advances in research and development of dental implants and dental materials. That's very important. Again, these are more examples of locator abutments. They can be used either for, those are used for removable. And here we see also how the sleeves are used for surgical stand for different type of surgical stands. So we can have tooth supported surgical stand, we have tissue supported or bone supported. And for each of them, we have a different sleeve, metal sleeve that goes inside that hole. Okay. So that's about it. If you have any questions, please ask. Thank you.